Hello again, it's Dr. Harim Jaffer, and this is my 5th lecture on Glossary of Periodontology. Please subscribe to my channel HL Talent to get more videos. We were in the letter A, part 1, and we reached to the letter A that followed by R, S, and T. Today I brought to you 10 other terms to be more obvious and understandable. First term we have argyria. This is a bluish-gray discoloration of the skin or oral mucosa from prolonged exposure to silver. It may affect the skin like this guy, or the discoloration of oral mucosa is usually occur due to overextended silver point or silver-containing sealers or amalgam that are used may cause subgingival or submucosal bluish-gray discoloration. So this is the term argyria. We have astringent, any agent that causes contraction of the tissue, arrest the secretion, or control the bleeding are named as astringent. For example, we have this product used for controlling the bleeding gums. We have atrophy and 4 types of atrophy. Atrophy is the reduction in size of a cell, organ, tissue, or part. And we have disuse atrophy, result from inactivity, when you use, for example, one leg more than other. And when you have a fracture and you have a plaster in your leg, and you should wait 6 months till the bone regeneration will take over. And after removal of the plaster, you see that one of the legs are atrophied, the non-used one, the fractured one, because it was inactive. And we have physiological atrophy, which affects certain organ in all individuals as a part of normal aging process. For example, like during aging, we have an atrophy of brain. While post-menopausal atrophy, here we have a thinning of various tissues such as oral mucosa following the menopause. So thinning of the oral mucosa, meaning that it will be affected more by infections, bacterial invasions than a normal person. While senile atrophy is the atrophy of tissue due to advanced age. It's nearly similar to the physiological atrophy. As you see it here, there's an atrophy of brain cells due to Alzheimer's disease. We have attachment apparatus. We have periodontium, which consists of gingiva, alveolar bone, periodontal ligament, and the cementum that covers the root surface. While attachment apparatus, we have cementum, periodontal ligament, and alveolar bone. Attachment level, we mean by clinical attachment level, or CAL, the distance from the cemento-enamel junction to the base of the pocket to the tip of the periodontal probe that hit the lowest part of the pocket. So this is the cemento-enamel junction, and this can be affected when the periodontal attachment apparatus will affect. So when a bone is affected, periodontal ligament is ruptured, cementum is affected, it will affect the measurement of the clinical attachment level. We have attrition. Attrition mostly occur, we mean by tooth. We have another attritions, but we mostly mean the tooth. So attrition or wear or tear occurring on the incisal and occlusal surface of teeth due to aging process, malocclusion, and presence of bad habits like bruxism or clenching. We should know that certain amount of physical wears or physiological wears also lead to attrition in almost every individuals. Atypia, the last term of today. It's a Greek term from a plus typos, meaning without type, or a condition being irregular or non-standard. It's a histopathological term for a structural abnormality in a cell that, say, it's used to describe a typical cell. So this is the terms of today. I hope you get benefit from it, and thank you for your listening. Join us in our channel HL Talent.